Okay, so this is like part 4. Where are we? Part 4 of the week 3 assignment stuff, and I want to go over this real quick with you guys because it can be a little confusing. So we're talking about sensory, which is information coming back to the central nervous system, and motor, information leaving the peripheral nervous system. You get to check these, which is kind of cool, and you can go through it. But if you say my finger hurts, that's definitely sensory. We're going to start up there. Winking is a motor issue. Afferent, so you have what's called efferent, which goes away or exiting, and afferent comes back towards. That's going to be sensory again. And I'm cold again is a sensory thing. From the spine to the thalamus, that's going to be also sensory. Carries information about pressure and pain, sensory. Oh my gosh, look at all these. From the cortex to the spine, that's going to be motor. So it says, if you look at this one here, it says cortico from the cortex to the spine. Okay, it tells you what it is. Spinocerebellar, that's going to go spine to the cerebellum. Carries information up to the parietal lobe. Anything going to the brain is going to be sensory. Most neurons decussate in the medulla oblongata. It's going to be motor. Electrical signal arises in the precentral side of the frontal lobe. Arises in the precentral gyrus. I'm going to put that there. Efferent, motor, going exiting, descending tracts, also descending away from. Pyramidal tract, I cannot remember off the top of my extrapyramidal tract. I'm not sure. Hearing voices, sensory. Ascending tracts going up towards the motor, and wiggling your toes is going to be motor. Now, these two little bastards, I'm going to have to guess because I cannot remember, and I'm not going to look them up right now because I only want to do like a 2 minute, and we're already at 2 minutes right now. So I'm going to put this one here, and I'm going to put this one here. We're going to see what happened. What did I miss? And I did them wrong. So I did pyramidal, retry. Pyramidal tract will go over here, and extrapyramidal will go, where was it? Over here in the sensory. All the other ones were correct. So you can go through that yourself and fix those things up. Hopefully you saw that. Anyway, this is like video 3 or 4. I don't know what it is. 4, I think, of this week for week 3. And I'm just going with 3 things. You can look up the other videos on YouTube, and I did put them in the announcements, and I think the weekly email. So you'll see more of those, and I'll post those again in a moment. Talk to you soon. Bye.